referred to as nutritionist to the stars.
Oh, thank you so much, Christopher. Happy to be with you again.
Again, this
Our
time,
third try.
actually broadcasting.
Yeah.
We had
I'm happy. I'm happy.
we had challenges, but this is our inaugural event.
Yes,
it is,
it is.
the first Total Health Live.
Total Health Live.
Yeah, because we're live.
We are live.
We are not dead yet.
Well, I'm hoping that everyone out there is the same.
Yes. I'm going to share to a couple of places here while you talk. We actually, in our group, had somebody asking about a condition. I went back in there and checked.
A condition?
Like yes, a condition. A medical condition, asking for dietary advice for diverticulosis.
Oh, diverticulitis and diverticulosis.
Yes. The osis versus the itis. The itis is acute.
Acute, exactly. Yeah, exactly.
But she was asking for the osis. Did you have any nutritional recommendations? So right off the bat, we've got somebody who wants to know your best advice.
No nuts and seeds and any kind of kernels, and you want
not even Colonel Sanders?
Not Colonel Sanders.
Good.
Stay away from fibrous foods.
Yep.
Everything mashed. Drink a lot of water and really stick. I mean, if it's an acute situation, you want to be sticking with, broth, something just really broths and liquids for about 3 to 4 days. So the inflammation can, come down, and then you can start eating soft foods, bananas, pureed foods would be good too. Soups.
Well, what about the long term? If you've got the diverticulosis, but you don't have the itis, you don't have that acute inflammatory lower left quadrant pain.
Well, I think you need to address your diet and look. Yeah. I mean, that's a pretty in-depth thing. I would look at the complete diet, what they're doing. Also, stress has a profound impact on how your body processes foods. But if you have that pocket, I mean, basically, diverticulitis is. We have many, many villi and pockets in our small and large intestine, and so they get inflamed, or food gets caught in it and gets inflamed, and then potentially infected, which could be a huge problem. So right now, we want to take all precautions so you don't end up with non-COVID-19 conditions, because non-COVID-19 conditions will not be addressed very easily and very readily at this point. If you were to go to your doctor's office, again, telemedicine is happening. We had a call with my husband's neurologist this week. That is being, not just telemedicine, but also just telephone calls with your physicians. But you want to take extra special care to do whatever you can to be healthy, not just the immune system, in every way. I mean, I had a little bit of a cut on my foot, and I just took every precaution because you don't know what it could turn into. And I mean, I normally do that anyway, but I was looking, the last time I went to the grocery store was March 17th, St. Patrick's Day.
St. Pat, did you buy green beer?
Did not buy any beer.
No.
Did not.
Okay.
I'm sure I bought greens, but no beer. Yeah. I have some wonderful grapefruit beer. I can't remember what it's called.
Grapefruit?
It's very, very refreshing in the summer on a really, really hot day. Huh. But let me just finish this. So when I went a couple of times during that week, and I noticed, this is when the rampage was happening, the initial rampage, and I noticed the boxes in my Trader Joe's, boxes of cookies, or the aisle of cookies, full with that stuff. Eggs were gone, greens more so than cookies, and lots of frozen foods gone, dairy gone. And I thought, wow, that's a really good sign. People are really focusing on good foods, right? And I hear a lot going on right now where people are, the COVID-19 weight gain, which I think is kind of bizarre. When you think about it, I mean, it's sort of like the opposite of what we should be focusing on. We should be focused on a healthier way of life in general.
Right. Yeah. Oh, we've got comments already appearing here. This is great.
Ah,
Jordan
good.
Michael Thomas, Farzam Tamami, my favorite dentist in the Washington, D.C. area. He says preventative medicine should include coffee enemas. Oh, yeah. I remember that. Was it? Oh, gosh, what was his name? Harold. The guy had a clinic in Mexico, and he used to do detox protocols for cancer patients.
Mm-hmm. Yeah.
And one of the things he used to say was he was a big believer in coffee enemas because they would contract the liver. But he would also say that you should have the coffee enema but with no cream or sugar. So that was important.
Well, in ancient Ayurveda, which is the medicine of India, 5,000-year-old tradition, similar to Chinese medicine, but this is centered in India. Ayurvedic traditions in their detoxification programs, they do oil enemas. Alternatively, when you do a full-on detoxification program, oil enemas as well as herb enemas.
Herb animals?
Yes, herbivores, right?
Herbivores. They're herb animals.
herb animals.
Herb
Anyway,
animal.
I'm not recommending anything like that sort of unusual
Good.
treatment at this point, because even the coffee enemas, I think, in quiet times, where you can kind of like, if something goes wrong, you can reach out and get some help. Try to be, the basics. All we need to do are the basics.
Well, and the basics include a simple thing like hydration, drinking water, sleeping.
Mm-hmm.
A lot of people have sleep disturbances right now.
Well, I think I actually experimented a little bit. I'm usually a good sleeper. I experimented a little bit because usually I'm watching comedy or some sort of romantic film or something towards bedtime.
Yeah.
But last night I was listening to some interesting, I don't know, controversial, but it was about the politics and the economics of what's going on right now. And so it was extremely stimulating. So it kind of did affect my sleep initially. And then my little kitty cat came and snuggled her head around my head. And, she's my bliss machine. What can I say?
Does your bliss machine purr you to sleep? Or
She purrs. She's such a cuddler. She's so sweet.
does she stick her tail up your nose at some point to wake you up?
No, she does not do that. But she's very rambunctious in the morning. She does like to wake me up. She'll nibble on me sometimes. Nibble.
She just likes the way you taste.
She wants to play. She wants to nibble. She wants her treats. She loves her treats. So do not be like my cat, wanting to get all your treat.
Stay away from the cookie aisle.
Treataholics, yeah.
Treataholics.
Nuts, seeds. Oh, again, if you have diverticulitis, you don't want to have any of those.
So let's move. If we move away from one specific condition, we talked a little bit about hydration, how incredibly that's important. I mean, some people like to mix a little lemon with their water, which may be a little more detoxifying. It helps to kind of slough off mucus, things of that sort. But also just the quality of the water, getting a good little filter in there if you can, because some of the chlorine. I mean, let's put it this way: I'd rather have tap water than no water.
Yeah, and you can boil the water too, the tap water, right? You can do that. So, remember that that's an option. I was drinking this, my husband, I don't know if I'll share with the viewers right now. My husband is highly compromised. We basically have a one-patient hospital downstairs, hospital bed, Hoyer lift, all sorts of things like that. So we get Meals on Wheels because it's a renal diet, but pureed, and it seems to be working just fine. I add things to that because they don't usually give you enough. They give enough for perhaps a 100-pound, maybe 90-year-old, 5-foot, small, tiny person, but not for a 6-foot. He's about 150 now, which is not his normal weight. So they don't give enough for him and his specific condition. So he gets Meals on Wheels, and they give us 2 of these waters every day, and he doesn't drink water because he's on a fluid restriction. So I was drinking these, and they had some minerals added to them. And then I started drinking my regular water, which is reverse osmosis, and I started sensing cramping, an increased amount of cramping in my body.
Yeah.
So I realized, okay, if I am going to have the reverse osmosis, I need to add some additional minerals supplement. So I have one.
So Dr. Tamami Farzan was saying, he said you shouldn't be watching anything, before bedtime. I think that's, binge watching just before bedtime is not a great thing. And he mentions also, says, how about the high pH alkaline water? I mean, that's actually a great idea. We actually have a very simple filter which comes from Austria, and it will actually not only filter out a lot of the chemicals like chlorine and others, but it actually injects magnesium into the water.
Yeah.
And we now enjoy that taste. And if it's missing, we say this, what's wrong with the water? Yeah. Because that magnesium does provide some additional, even relaxation for the muscles. That would kind of explain the cramping thing.
The magnesium, and there is an alkalizing. A lot of them have sort of sodium chloride, hydrochloride, or bicarbonate, sodium bicarbonate added to them, which will have an alkalizing effect. I mean, most waters are between 7 and 8.5 pH. Yeah. So, I mean, I recently been doing a fair bit of research in this area. So there's definitely differences in waters that you can get.
Well, and I used to take, before I left DC, I actually had a weight loss clinic, which was hilarious, only because more people were interested in weight loss than they were having their spine straight or doing anything, but then pain relief. They really wanted to look good. That's where vanity would top anything to do with health. But one of the things I do remember is a lot of them say, well, I can't drink this. I can't drink water. I hate water. And they would go to sparkling waters, which are high in carbonic acid, like Perrier and others. And that just would make them more acid. But you have to go through this process of weaning people. First, you got to wean them off of sodas. Then you got to wean them off of the diet sodas. And then, in fact, the diet sodas were the ones that really seemed to be the most addictive to a lot of the patients I had.
Well, that's why products like Hint Water came to be. There was an essence of like some fruit or whatever. So it would be, it would taste different. It would taste better. But it's habitual. It's a habit. You have to create these new habits, and definitely hydration is key for health. Absolutely, and it's definitely going to help your sleep as well. And, during stressful times like we're in right now, our body is certainly turning acidic, certainly becoming more acidic.
And the cortisol is going crazy. So.
Cortisol's, I mean, all our hormones. I mean, before we came on, every week I seem to have a theme song. So 2 weeks ago or 3 weeks ago, it was David Byrne, Talking Heads. What was it? On our nowhere. What was it called? Oh. On the Road to Nowhere. I was singing that song. Last week it was The Eye of the Hurricane from Hamilton. Today, The World is Turned Upside Down, another Hamilton song, which is true. The world is turned upside down. In fact, my office now is turned upside down.
That's right, because we switched you. We switched you from one side to the other.
But we don't know where to turn. I mean, nothing is grounding. I just wrote an article about staying grounded in this time, right? How to stay grounded. And, I've been taking care of my husband and, doing my practice, a lot of my practice from home. So I'm used to being at home, but a lot of people aren't, It's just a new, what can I do? What can I do? It's just, people just aren't used to this. Not that we should get used to it, but it requires developing new skill sets and new priorities for sure.
And a degree of discipline, because I always maintain you have to really have a workspace that is totally dedicated to workspace, even if it's in the same room, God forbid, the same room where you sleep or where you eat, that one little space, you do not do anything else but work in that place, because you need to anchor yourself and really be dedicated to getting the mindset straight that you're going to be focused on being productive in this place, not surfing the web, not watching Netflix from your laptop, even though you could. And so there's so many digital temptations that are involved with working from home. that you talked about earlier. It's good to establish these new habits. It's the new habits of thinking, new habits of action, having water right next to you when you're working, getting up periodically, because people who sit for more than, they have studied men who sit for more than 3 hours a day have something like, I think it was around 30% shorter lifespans than those who get up and move around.
Yeah, I mean, it's contradictory for so many things, but you know, even standing up if you're on the computer, I do this often. I'll stand up and look at the computer. You know, I'll sort of adjust it so I can stand and look at what I need to stand. Right. There's so much online, especially now, right now. Well, there always has been a lot of things online for different kinds of exercising. I turned on some ballet a couple of days ago because I've always loved ballet. And, you know, there's yoga, there's everything. There always has been things like that. I know we're not talking about working right now, but as far as taking these breaks, these regular breaks every hour or so and doing something, if you can't go out, and I literally haven't been out.
Well, I actually did go out today. I went because early enough to head to the beach. The beach. And it was actually interesting that there weren't, but the problem is in the afternoons that at the beach here, people gather around the stairways that are going down, and that screws up your social distancing. But in the early morning hours, you can actually get to the beach, get off, and people are very respectful of one another once they're actually walking along the water's edge. It's just in the areas where they congregate or on the sidewalks where they're trying to get to there is where the problem is.
Yeah, you know, we have the stairs, they're called the stairs or steps in Santa Monica, shut down. They were shut down, I believe, earlier this week, because that's a huge popular place that we have, you know, in the Santa Monica area. So they probably need to do that in your city.
Well, they've kept it open only because people have been very well behaved. But we had a big influx of people yesterday, and it became more perilous. Let's put it that way, because there are just a couple of beaches that are still open in San Diego, and the problem is that everybody gets word of it. It was even published in a paper, and suddenly somebody's going in there, and it's no longer social or physical distancing. It's like, hey, let's.
Yeah, I mean, it's the complete opposite of what it should be. So where are some of the authorities and leadership? Where's the leadership?
No, it is there. I mean, I understand their reasoning behind it, because for the residents, you know, Monday through Friday, people are really well behaved. The challenge is now
that's the weekend.
Monday through Friday and Saturday and Sunday and everything. Because there still are essential workers who are working Monday through Friday, and then they come out on a Saturday and Sunday, and typically it's the invasion of the tourists, and we just stay away from those places.
So interesting. I would think that people who are essential service workers would just want to rest on the weekends, just stay inside and rest.
You never know. There may be somebody who just wants. Maybe there's a trash worker who's considered essential who wants to lie on the beach with a family.
Yeah,
that's a way to rest. So
I mean, you know, I posted something yesterday because my husband has the TV on often, and there was sort of like public service announcements from celebrities saying stay inside, and it was sort of like a vigilante kind of tone to it. I mean,
vigilante tone.
Yeah, but in
lock you up.
Comedic light way, it was sort of vigilante light, if you will.
I see.
And so I posted that on Facebook. I said, so that's what I'm seeing. Any comments? No comments. So, but it's like, I don't know. It's a whole different way of viewing everything right now. I mean,
it's interesting because, you know, when you put people under stress, you sort of find out what their real character is like, just to a great extent. One of my favorite sayings from my dad was, when you squeeze an orange, you get orange juice. And when you squeeze a person and put pressure on them, you get the juice of them that's inside.
How about when you squeeze a Charmin?
Don't squeeze the Charmin. Well, if you can get the Charmin. Somebody posted something I thought was hilarious. It was they said in Coronado here, somebody just TP'd my house overnight, and suddenly my value has increased to $875,000 for my property. Because of all that toilet paper, of course.
Yeah. Well, it's a rare commodity right now. definitely rare.
Rare, medium rare. It's getting a little better.
I don't know.
Yeah.
I sent one of my husband's healthcare aides out to our local Sprouts. I don't know if you have them down there, but they're like Whole Foods.
Yeah,
Similar
there are a couple Sprouts in San Diego.
Yeah.
My dad used to refer to all 5 of us kids as his Sprouts.
Sprouts, yes, yes. Yeah.
So she came back with food, or?
She came back with food. The only thing that was missing, even chlorine bleach. I don't want to advertise it. It's available.
I know.
Chlorine, non-bleach chlorine, actually.
Yeah.
So,
well, before they closed the border here into Mexico, my wife and a couple of friends went shopping, and they got bottles of alcohol, isopropyl alcohol, which we could not find here in San Diego. Yeah.
Well, you can make a bleach, a kind of a bleach with isopropyl alcohol and water. And so there's like a whole Google-a-thon you can do with regards to homemade kinds of things, that you can do, that you can make. Is that what you were referring to when you mentioned the isopropyl?
No, we just needed it because we have caregiver activities here too. And
please, I want to X that, please, before we go any further. It wasn't isopropyl alcohol; it was hydrogen peroxide.
Well,
please, no, please.
Remember, folks, it's the H2O2.
Yes,
not the H1N1.
Yeah, no. I just had to immediately correct myself for, we have to be very careful what we say and advise. So,
no kidding. And by the way, too, anything that we say here cannot be used against us in a court of law, because this is actually for educational purposes only.
Educational, informational, yes.
Always check with your doctor. I should have done the disclaimer at the beginning, but hey,
hopefully
that's just the way it is
as well. Hopefully some lightness and cheer.
Well, there has to be some lightness and cheerfulness. I mean, the healthcare workers have wicked senses of humor. My dad it was amazing. After you he must have worked on probably about 40,000 patients in his career. And you develop an interesting sense of humor when it comes to even life and death issues. I have a couple of friends who worked in ER medicine, and humor is it's a way of surviving. It's a coping mechanism.
You have to. I mean, the last 5 years I've been literally saving my husband's life over and over again in various ways, whether it's just organizing, getting him to the hospital, whatever, getting, the proper people around. So if I didn't have laughter and ability to laugh and make jokes and, do whatever I can, it's like the best medicine. It's the best medicine.
It is. There's a poem called "The Land of Beginning Again." I think it's Louisa Fletcher. And my favorite line from there is, "I think it's the laughter. That's what we're after in the land of beginning again." Yes. Yeah. One of my favorite.
Amen to that. Yeah, laughing.
Ho, ho, ho.
My mother's favorite line is one of her favorite lines is, "Enjoy your life." And she's going to be 99 in a few months.
Wow. And God bless her. That's spectacular.
She needs to say that. Yeah. Enjoy your life. She has a little accent, so.
Is it a German? Is it a Deutsch accent?
A little bit, sort of. Yeah. Kind of.
It's a Canadian? Does she say,
no.
Willkommen, eh?
It's a little bit sort of European. Let's call it European. Not necessarily German.
Okay.
Because she didn't really grow up in Germany, although she's German.
Where did she grow up?
She grew up when my father was born. It was the Austro-Hungary and then it became Poland and that kind of thing, sort of.
Yeah, one of my I think it was my paternal grandmother's family were ethnic Germans living in Posen, which was part of Germany and then is now Poland.
Yeah. They were originally from both sides, originally from the Rhineland. Yeah. And then they went over. But anyway, so she has "Enjoy your life" is the motto.
Enjoy your life.
Enjoy your life.
I think that's actually a good way to kind of wrap up today, because we want to keep these things kind of short and sweet. And if more folks want to ask questions, we'll check things in the comment section here.
I love this show. Is that what I see?
They love this show. That's Dr. Tamami. That's my My dentist.
Oh, well, my brother's a dentist, and he
That's right.
tested positive because he attended a huge conference.
Yeah.
At the beginning of March, and so he and his wife now have tested positive. So they're in complete isolation, and so I would love everybody's prayers for them because everybody needs that.
Everybody needs good wishes, good vibes, encouragement,
good vibes,
and hoping their symptoms are mild to moderate and not requiring hospitalization. So.
Well, they were in the hospital, but they were still at home. So I'm so glad we were able to do this and to
we worked out all the bugs.
Yeah. Yeah.
We're antiviral in terms of hopefully the show goes viral without being infectious. So.
Yes. Well, we'd like to be a different kind of infectious, right?
Yes. Infectious laughter.
Yes.
Ho.
Yes.
Bad
medicine.
Bad jokes, quips, experiences.
Enjoy your life.
Enjoy life. Hey, life. It's good for you.
It's good for you.
Yeah. All right.
Thank you, Christopher. Thank you, everybody.
It's my pleasure. I think we didn't do too bad. We got 28 minutes. We got under that half-hour goal, and we did not blow up the internet. So I'm happy about that. Okay. We will be back at a time to be determined.
Sounds good.
Stay healthy. Stay well. Keep your spirits up, and we'll see you soon.
Bye, y'all.
Bye.